Feeding newborns. When you feed your baby, it's important that you do it safely. To do this, there are 3 key things to be aware of. First, your baby's developmental stage. How your baby eats and how much will depend on their age and development. In this video, we're going to talk about feeding newborns. We will talk about introducing solids in another video. Second, your baby's cues. It is important to know and to respond to signs that let you know when your baby is hungry and when they are full. Third, it's important to know how your baby shows distress. Along with knowing when your baby is hungry or full, it's important to know the signs that your baby is having trouble with feeding. When new babies cry, it's natural to think that they must be hungry. But not every fussy baby is a hungry baby. How can you know if your baby is hungry? Here are some clues. Your baby roots, which is the term we use when babies turn their head and open their mouth in search of a nipple. Your baby sucks on their hand or makes sucking noises or motions. They may also suck on the pacifier but then spit it out. Your baby clenches their fingers over their belly or chest or bends their arms and legs inward. All of these can be signs that your new baby is hungry. How do you know if they are full? Here are some clues that your baby has had enough. Your baby's sucking slows or stops. Your baby pulls away from the nipple or pulls their head away when you try to put the nipple in their mouth. You may also notice that your baby is more interested in other things or people than in feeding. Your baby falls asleep. While most babies fall asleep when they are full, some fall asleep just from the comfort of feeding and might wake up a little while hungry again. This is particularly true of breastfed babies. If your baby falls asleep, you can try waking them by talking to them or gently tapping their foot. Those are some tips for knowing when your baby is hungry or full. Now let's talk about some tips for safely feeding your baby. Let's start with feeding directly from the breast. Hold your baby so that the breast doesn't block the nose. Your baby needs to breathe too. Listen for sucking and swallowing. That's how you know it's going well. Be on the watch for letdown. That's the burst of milk that can spurt into the baby's mouth a few minutes into feeding. While most babies are happy for the extra milk, sometimes babies sputter when this happens and need to come off the breast for a few seconds. Be mindful of how tired you are. Make sure that you don't fall asleep while you are nursing and either drop your baby or, if you're lying down, roll over onto them. Now here are some tips for safe feeding from a bottle. If you heat up the breast milk or formula, check the temperature before you give it to your baby to be sure it's not too hot. Never microwave a bottle. Use a nipple that is meant for your baby's age and size. If you aren't sure which nipple to use, talk to your doctor or nurse. Never cut the nipple hole, as this can increase the risk of your baby choking. Keep your baby semi-upright, not flat, so that they don't choke. Be aware of how slowly or quickly your baby is feeding. If they slow down and seem to want to break, let them have it. If they seem to be sucking very quickly, you may want to stop after an ounce or two. See if they need to burp, and then let them have some more. Don't prop the bottle. Someone should always be holding the bottle. Angle the bottle so that the milk fills the nipple. This way, your baby swallows more milk and less air. As with breastfeeding, be mindful how tired you are. Falling asleep while holding and feeding a baby can be dangerous. Most babies feed without any difficulty. However, sometimes babies do have trouble, whether it's from an illness or some other problem. Here are some signs that your baby is having trouble with feeding. Your baby sputters or coughs frequently during a feed. An occasional sputter or cough is normal, especially for newborns, but they should settle quickly. If your baby isn't settling, or if the sputtering or coughing keeps happening after they settle, that could be a sign of a problem. Your baby has a weak suck, and either takes a very long time to feed or only takes a small amount. Your baby gets tired, sweaty, pale or bluish with feeding. Your baby fusses frequently during feeds, as if something about the feed is uncomfortable. While it's normal for babies to spit up, very frequent or large spit ups could be a sign of a problem. If any of these are happening with your baby, or if you have any questions or worries at all, call your doctor or nurse. Thank you for watching this video on keeping babies safe.